Okay, good evening everyone for joining for this webinar. Just to introduce myself, my name's Dr. David Garley. I'm director of the Best Sleep Clinic. I'm here with Emily, who's one of our senior sleep physiologists.
Hello,
and we're going to talk about obstructive sleep apnea, and I will show you the slides. Okay, yeah, so we're going to talk about obstructive sleep apnea. Just as a bit of introduction to us as a clinic. So we are the Better Sleep Clinics. We're an online sleep clinic. We're based in Bristol, but we work throughout the UK. And we work with a variety of different sleep conditions, probably most commonly insomnia and obstructive sleep apnea. And so in terms of what we'll cover with the webinar, we're going to start with actually the background on sleep. So obstructive sleep apnea is quite an unusual condition, and it's really helpful actually to get a bit of the background on sleep. So we'll look at why we sleep and why it's important, how it impacts our health. And then we'll talk about what sleep apnea is, who gets it, how it's diagnosed, how it's treated, and then we'll do Q&A at the end. If you do have any questions on the way through, please do say. And I know that a few of you have actually sent in your questions in advance, so we'll do a couple of those at the end. And just to let you know, we are recording this webinar, so if you do have to run off, that's fine, and we'll get that online probably over the weekend. So first of all, why do we sleep? And it's a good question, and we don't know 100%, unfortunately. Sleep's quite a difficult thing to research, but there are some more certain areas that sleep impacts. So one role is physical rest and recuperation. I think a lot of people would be familiar with that. The majority of your growth hormone is actually released overnight when you're sleeping. And so if you're missing out on sleep, you're missing out on growth and repair. In a similar way, your immune system is restored. Your immune system is often in the form of protein-based antibodies, and it's actually at night that a lot of that is restored. Memory formation is a really important function of sleep. And actually, this is really important for moving memories from your short-term memory to your longer-term memory, something called memory consolidation. There's lots of research being done on that. Emotional regulation. So a lot of people would probably agree that if you haven't slept very well, you're often quite irritable the following day. And this can be due to a specific state of sleep called REM, which we'll touch on later. That's rapid eye movement. And there's some research that suggests that some of the waste products that the brain produces are cleared more exclusively at night than during the day. And really looking at why sleep is important comes back to the functions. And a lot of us will know that if you haven't slept well, you know that familiar feeling of feeling like a zombie, feeling sleepy, tired throughout the day, not able to concentrate, having a terrible memory, often being quite irritable. And that can be after one night of poor sleep, but actually, if you have slept badly for weeks or months or years perhaps, that actually the impact on your health can be slightly more sinister, affecting both your physical and your mental health. And more specifically, the areas that are commonly affected. So in terms of physical health, your cardiovascular system can really take a hit. Actually, when you're asleep, your blood pressure is lower, your heart rate is lower, and it's this kind of state of cardiovascular respite that you can miss out on if you're not sleeping very well. And poor sleep is linked to much higher cases of hypertension, heart disease, and stroke. There's some research that suggests that poor sleep is actually a comparable risk factor to being overweight in the development of type 2 diabetes. It also impacts your mental health, and this is one of the areas that's most researched at the moment. We've known for a long time that certain mental health conditions can impact your sleep. So anxiety can make it quite difficult to fall asleep, and depression famously causes early morning wakening, not all the time, but it can do. But what we know from research now is that sleep actually works the other way and actually can cause these mental health conditions. And actually, when poor sleep is both a cause and an effect of a mental health condition, it does mean that these two conditions can really feed into each other and quite rapidly escalate. So it's important that you address both of those if you're working in a sleep clinic. In terms of workplace safety, there's good statistics that show that your risk of an accident is much higher if you're not sleeping well, and that affects certain workforces, particularly those working shift work. And then the other really challenging statistic that we come across regarding road traffic accidents is actually that 20% of car crashes are linked to poor sleep. I think what's really striking about this is that there really is no area in your life that's not impacted by poor sleep. But what is sleep? So we've always traditionally felt that sleep is almost like a passive state of rest, but actually on a cellular level, it's very busy. Sleep is not one state, it's actually, broadly speaking, split into two. One of these states of sleep is associated with quite brisk fluttering eye movements and so-called rapid eye movement sleep. And then the other side is not associated with these movements. And so it's quite creatively named non-rapid eye movement sleep. And this, or non-REM, is further subdivided into N1, which is very light sleep. This is the sort of sleep you do in front of Netflix if it's not very interesting. This is really light dozing, and you might not even know that you're doing it. There's N2, which is still considered light sleep, but slightly deeper. And then N3. And N3 is the really deep, restorative sleep that you need to get to feel refreshed in the morning. And these types of sleep have different functions. So REM, or rapid eye movement, you might be aware is actually the state in which you do your very vivid dreaming. In fact, it's so vivid that your body actually has to paralyze you during this state so you don't act it out, something called REM atonia. And REM is thought to be particularly important in emotional regulation. And then non-REM is more to do with those functions of sleep, which I mentioned earlier. And not all the states of sleep are visited equally. N1 and N2, both forms of light sleep, you get up to about, it was usually around half, 50% of your nights. Deep sleep, more like 20% perhaps, and REM slightly less than that. And actually, you visit these states of sleep in turn. So this is called a hypnogram, and what it shows is something called your sleep architecture, which I think is a really fantastic term. And this refers to the route that you take through the different states of sleep. So this person's fallen asleep at around 11 p.m. They've gone straight into N1, that's the really light dozing, into N2, and then at what's that, around half 11, they've had their first bout of N3, the really deep restorative sleep that you need to get to feel refreshed in the morning. And then they've worked their way out, skipped N1, gone straight to their first bout of REM sleep, and then they've woken up. And what they've done there is called a sleep cycle. And on average, that's around 90 minutes. And they've woken up. And this is something that you do after a sleep cycle. You're not always aware that you have. And there's different theories about why this happens. One really comes back to a kind of evolutionary view of sleep and how vulnerable you are as a mammal when you're sleeping, that you could be lay on the floor for, could be 8 hours, eyes closed, not listening, and any predator could come up and eat you. So there's some theories that you actually wake up after a sleep cycle so you can recheck your surroundings, check no predators have moved in, and go back to sleep again. And this idea of sleep architecture and the different states of sleep is really important when we think about how sleep apnea impacts you the way that it does. So what's sleep apnea, obstructive sleep apnea? So obstructive sleep apnea is a condition associated with snoring where your upper airway repeatedly closes as you sleep. And it's an unusual one, and it does need some explaining. And what it really comes back to is your upper airway. So your upper airway is made of either hard structures or soft structures. So hard structures are like the roof of your mouth, which is the bony bit just there, and soft structures like the back of the throat and the base of the tongue. Hard structures are held in place by themselves, but soft structures are held in place by muscles. And the issue is that as you fall asleep, these muscles relax, and it means your airway just narrows in on itself as you sleep. Now, when your airway is slightly narrow, the first thing you get is turbulent airflow. And this causes the soft structures to vibrate, which we hear as snoring. But if the airway actually narrows even further, the airflow itself gets restricted, and then the airway will actually close and you'll stop breathing. And when you're not breathing, your oxygen levels are going to drop. And your body can only tolerate this for so long before it actually becomes alarmed. It sounds the alarm. It actually has to pull you back to a shallower state of sleep or even completely awake, so that your muscles regain their tone, pull open your airway, and you start breathing again. And this often starts with a bit of a snort. It's quite similar, actually, if you've seen anyone falling asleep either upright in a chair or on a train, that kind of situation. But someone will be sat upright and they'll fall asleep, and the head will be bobbing like this. And what that is as you fall asleep, the muscles at the back of your neck are relaxing, and they're not able to support the weight of your head anymore. And it just bobs and bobs. And it's the same with sleep apnea. You bob, and then finally you do one big bob and you wake up. And it's exactly the same in sleep apnea, except it's those respiratory muscles, those airway muscles that are falling asleep. And the issue is that you will never go into those deep restorative states of sleep that you need in order to feel refreshed in the morning, because whenever you do, your muscles relax, your airways close, you stop breathing and your body has to wake you up again. And this is why even if you sleep for 10 hours, it's such poor fragmented sleep that you still wake up feeling very unrefreshed. And so this is why you get the nocturnal symptoms of sleep apnea. So this is the loud snoring, the stopping breathing, and the snorting or gasping. And this is why you get the daytime symptoms. Because the sleep is so fragmented and poor quality, you wake feeling unrefreshed. You feel sleepy all day, you fall asleep in meetings, you'll fall asleep when you're driving. You get really poor memory, poor concentration, and a lot of people are actually depressed. You actually get quite striking physical health problems, so particularly affecting your cardiovascular system and your risk of diabetes. But there's also statistics that show that around 20% of people with obstructive sleep apnea are actually depressed, which you could imagine if you think back to how you feel after one night of bad sleep, imagine having that for 10 years. You can really see how that can make an impact on your mood. So on to who gets obstructive sleep apnea. So sleep apnea is a really common condition. If you look at the population as a whole, it's probably about 2.5%, depending on what statistics you look at. But looking at certain people groups, certain population groups, it can be, for example, 10% in over 50s. But the really big statistic, which we struggle with as a clinic, is that 85% of those with obstructive sleep apnea are actually undiagnosed. So these are people at home whose airways are continually closing overnight, fragmented sleep, waking up feeling unrefreshed, falling asleep in meetings or driving, or poor concentration. They have all these things going on, but they're not diagnosed. And there are some things that make sleep apnea more common. So being older is one risk factor. Carrying more weight is a risk factor, just because it puts a bit more pressure around your neck. And there's some other things that, being male is a risk factor. Anything that narrows your airway, so smoking can narrow your airway by causing some airway inflammation, and anything that causes those muscles to relax, so alcohol or certain sedating medications, is also relevant. It's also more common around the perimenopause and menopause. But a really important thing here is actually anyone can get sleep apnea. So while it is more common with these risk factors, it can affect anyone. And actually, in our clinic quite recently, we've had quite a lot of young female patients booking in with a normal BMI. So just because you don't have these risk factors, it doesn't mean that you can't have sleep apnea. And then we're going to talk about how sleep apnea gets diagnosed. I'm going to hand over now to Emily, who's going to take it from here.
Thank you, Dr. Garley. So how do we diagnose obstructive sleep apnea? Now, the traditional method would involve a patient coming into hospital and having what we call an overnight full polysomnography, or PSG. This type of study would involve the patient being hooked up with lots of different wires, electrodes, monitoring sort of brain activity, muscle activity, bands across the chest, a nasal cannula monitoring flow, lots and lots of different equipment. So adding all this equipment, as well with the unfamiliarity of being in a hospital bed, can ultimately impact their sleep quality, and may mean that the sleep quality that they're getting is not quite representative of a normal night's sleep. So fast forward to now, more commonly we use a home sleep apnea test. So home sleep apnea tests are portable devices that the patient takes home, applies the equipment themselves, and then returns the sleep study to the clinic for the results to be analysed. They're a lot smaller, really easy to use, and they're also carried out in the comfort of your own bed. So we are going to get sort of a normal night's sleep for that patient. The sleep study that we use at the Better Sleep Clinic is called a WatchPat sleep study. This sleep study has actually been approved by the main sleep regulatory body to accurately diagnose sleep apnea. It's been compared to the results of a full polysomnography and has been found to be really, really accurate. Sorry, I just can't move on. I got control. Thank you. So this is what the sleep apnea tests look like. When you order it, it'll get delivered the next day and comes in a little box like this. Small piece of equipment, really easy to put on. You'll get emailed as well a video link with the full instructions of how to use the equipment. There's a chest sensor that's simply just stuck to the chest. That wire then goes down the pyjama sleeve, and you'll wear the watch on the non-dominant hand with the finger probe placed on as well. And it's that easy. This type of monitor gives lots of different information with regards to your sleep's quality, your sleep staging, and importantly, your breathing during the night as well. As you can see on the screen here, these are the signals that the sleep monitor records. So the watch itself will record actigraphy, or in other words, movement. So when the sleep study is returned to us, a physiologist will go through the study and analyse all of the data. This actigraphy allows us to determine if a patient is asleep or if they're awake at different points in the night. The chest sensor records snoring. It also records chest movement, which allows us to detect different types of sleep apnea, and it will also record the body position. So in certain patients, their sleep apnea will predominantly occur when they're laying on their back. So potentially when they're laying on their side or on their front, their breathing will be normal, but when they're laying on their back, they'll be having lots of these apneas. And this is termed positional sleep apnea or supine-related sleep apnea. So having this sort of information can then ultimately allow us to guide treatment options. The finger probe, so this measures oximetry, so specifically blood oxygen levels during the night. As Dr. Garley explained, when these apneas occur, the oxygen saturation will fall. It also monitors heart rate, which allows us to, again, distinguish different sleep stages and also detect these arousals, these awakenings that happen after each apnea. And importantly, the main thing that the watch PAT uses, the innovative signal, is called PAT signal. PAT stands for peripheral arterial tone. It basically is just looking at the vasculature and how that's responding when you're asleep. And again, this allows the physiologist to detect and score these micro arousals that occur after each pause in breathing. So after you've completed the study, the results are then either uploaded via your smartphone, they can be remotely sent to us, or you can return the WatchPat device via post, and we can download it that way as well. You'll receive a full report within a couple of days of completing the study, and this is the type of report that you can expect to receive. So you'll get a full write-up of all the information. It goes through in detail your sleep. So for example, information on your sleep latency, how long it's taking you to fall asleep, your sleep efficacy, so the amount of time you're asleep compared to the amount of time you're in bed. It'll also give information about the amount of time you spent in different stages of sleep and whether this is normal. Goes into detail about snoring, heart rate, breathing, and importantly, you'll get a diagnosis that the sleep study has found. You'll also get a full explanation of what this diagnosis means and what is occurring when you're asleep. And as well with this, you'll get guided treatment options, so specific to your severity of sleep apnea and also your symptoms and clinical history. Along with the write-up, we'll also get the data. So this is just shown on the next page of your report. Here you'll get all of the readings. So for example, you'll get the total sleep time, you'll get what we call AHI. So AHI just stands for apnea hypopnea index, which refers to the number of pauses in breathing that you're having per hour of sleep. This ultimately allows us to grade the severity of your sleep apnea. So for example, an AHI of less than 5 per hour would be normal. On this study, you can see an AHI of 20, which indicates the patient's got what we call moderate sleep apnea. But again, don't worry too much about knowing all of this because it'll be included in the full write-up. You also get information on your blood oxygen levels, heart rate, really interesting graphs here as well. So you can see sort of when the events were occurring in blue. Orange is indicating the snore. So you can see for this particular patient, they're snoring pretty much all night. At the bottom, you can see this hypnogram. So this is looking at the sleep staging. You can compare this to what would be normal and actually see the impact that the sleep apnea is having on your sleep cycles. Finally, on the final page of your report, you'll get information on whether the apneas or the pauses in breathing are occurring when you're predominantly laying on your back or whether you're laying on your side. So again, this indicates positional sleep apnea. You get all of the snoring information, so how loud your snoring was that night. And here you can see the amount of time you've spent in each stage of sleep. You can book a consultation through our clinic as well with a sleep consultant to discuss your clinical history, your sleep report and your diagnosis and treatment options in detail. So how do we treat obstructive sleep apnea? This ultimately depends on the severity of your sleep apnea and also the impact that the sleep apnea is having on how you're feeling during the daytime. So for milder cases, we'll recommend lifestyle modifications, things like weight loss, exercise, reduction in alcohol, stopping smoking. For people with positional sleep apnea, so where the sleep apnea is occurring predominantly when they're laying on their back, we may recommend positional therapies as the first line treatment option. Therapies can be as simple as sewing a tennis ball into the back of their pajamas, or sort of wearing backpacks or belts that have a cushion on the back that actually prevent the patient from rolling onto their back. Then there's newer devices that actually vibrate as a patient rolls onto their back to sort of shuffle them back onto their side. Again, for mild sleep apnea, we can use what's called a mandibular advancement device, or MAD. This is a type of mouthguard or anti-snore device that is moulded to the teeth, usually made by an orthodontist. It sort of holds onto the top teeth and the bottom teeth. It's designed to move the jaw forward a couple of millimetres and also hold the tongue forward. It prevents any overcrowding at the back of the airway and ultimately opens up the airway space at the back of the throat. For more moderate to severe sleep apnea and those with significant significant symptoms, we would recommend what's called a CPAP machine. So CPAP stands for continuous positive airway pressure. You may have come across one of these devices before. It's the gold standard and best treatment available for more severe or moderate sleep apnea. The way that it works is it would deliver pressurised room air via a mask, either a nasal mask, one that just covers the nose, or what we call a full face mask. So the air pressure would be delivered through the mouth and the nose. If we just go on to the next slide, you'll be able to see a picture of it. There we go. So it's worn all night. The device would sit on the side of your bed, connects down a tube and then onto the mask. It's designed to deliver pressurised room air to just splint the airway open to stop the upper airway here from being able to go narrow and collapsing. I often explain to patients, if you imagine your airway as the inner tube of a bicycle tyre, if you imagine that bicycle tyre's got a puncture and it's collapsed, it's gone all floppy, if you then just blew air continuously through that tyre, it would splint the wall open and it would hold it nice and wide. So that's the theory behind the CPAP machine. It's delivering pressurised room air to maintain the airway and support it. We offer CPAP through our clinic, and here is a picture of the CFAM S box that we use, which is what we call an auto CPAP. And all that means is the pressure automatically adjusts throughout the night. It increases and decreases according to your needs and according to how much pressure is needed to hold the airway open. Really effective at preventing the airways from collapsing. It stops the apneas, and therefore it stops these arousals from occurring after each apnea. Ultimately means you can just stay in that really deep, good quality sleep for as long as you need to feel refreshed and restored the following day. It improves things like your energy levels throughout the day, your mood. Often people wake up feeling much more alert, less groggy, overall just really big improvements in how they feel the following day. It also has sort of the added benefits of cardiovascular benefits, so it sort of takes that extra stress off your heart and your cardiovascular system that occurs when you're having these apneas throughout the night. You can order the CPAP via our clinic. We have a CPAP package which includes a full CPAP setup, which is done remotely with a physiologist. So you've had a video call where we would go through the CPAP machine, demonstrate how to use it, answer any questions regarding it. We'd also determine the correct style and size mask for you, and then that would be sent out you'd receive it within a couple of days. We usually have most people up and running with their CPAP machine within sort of a week, so really fast turnaround. It's really easy to use, so as soon as they receive it, you can pop it on the first night and start to get the benefits from the CPAP machine. We also have physiologists on hand to offer ad hoc support throughout the journey. So if you're having any sort of like teething problems with it, need any adjustments or any advice, then we can give that along the way. The package also includes a follow-up appointment 2 weeks into your treatment, and again 6 weeks in. And the CPAP machine itself is actually recording your sleep data. So it's recording things like your CPAP usage, your mask, whether your mask's been fitting well. It also records the number of apneas that you're having whilst you're wearing the machine. So this gives sort of positive feedback to show that the equipment and the treatment is actually working really well to treat your sleep apnea. During these calls, we'll also have a full discussion to ensure that the patient is getting on well with CPAP, and just really hear the positive impact that it's having on their day-to-day life. So ultimately, if you do think that you may have sleep apnea, if you've got any of these symptoms, then it's really important to get that home sleep test and hopefully start treatment as soon as possible. Dave, I think your mic's off, sorry.
Okay, it's a bit better. Yeah, thanks, Emily. So this brings us to the end of the webinar. So if anyone has any questions, then do feel free to ask. We have got a couple that were sent in earlier, so we can maybe start with those. So we had a question that came in earlier that was, is CPAP easy to get on with? And I actually thought this was a particularly good question, because if you think about any illnesses that you've had before, treatments are usually much more conventional things like, medicines or surgeries. CPAP is a slightly unusual treatment. It seems slightly unorthodox. And the question is, will you get on well with it? And actually, if you think about what it must be like to have really bad sleep apnea, to not be sleeping well for years or decades, and actually when you give someone CPAP, which is a really effective treatment, and they put it on and actually start sleeping properly for what could be the first time in a decade, that actually if you speak to them afterwards and say, how are you getting on with the CPAP, they're often getting on a lot better than you think, because they've actually got this kind of brisk restoration of proper sleep. We had a patient quite recently who, I think it was day 2 or day 3 of treatment, said that he's normally asleep by about 8 o'clock, and it was 10 o'clock at night, and he'd read something like 150 pages of his book. And so your quality of life goes up really quite briskly in a lot of cases. It is an unusual treatment, and it does take a bit of time to get used to, and that is why we would always say that if you're going to consider CPAP, that you should always get this through a clinic, somewhere that someone like Emily can set you up with the CPAP, talk you through how it works. It's really important to make sure that your mask is right, so we have different styles of mask and different sizes, so we always make sure that we get the right mask for you. You need someone to be able to support you if you have any minor niggles. Sometimes the pressures need tinkering with, but it's all things that can be done. And we do this a lot. This is one of the big things that we're really hot on. So as Emily was saying, we have the follow-up at 2 weeks and 6 weeks, but we also have, we're always on hand. So there's ad hoc advice whenever you need it. And this is important. And this is why our clinic actually has much higher success rates with CPAP than the national average. So it's what's called compliance. So our patients actually get on better with their CPAP, and it's as a result of having that good care. So it can feel like an unusual treatment. There's absolutely reasonable first place to start, but do give it a chance, because you might find that the benefits that you get outweigh some of those hesitations you might have about this unorthodox treatment. There was another question for you, Emily. So what if I don't sleep well on the nights of the home sleep test? Which is one we get asked quite a lot.
So yeah, I mean, it's not uncommon for that to happen. It can feel sort of a little bit strange knowing that you're being monitored and wearing this sort of wristwatch. We don't necessarily need a whole night's sleep to be able to allow for an accurate diagnosis. As long as we've got a few hours of sleep to use, we can definitely decide whether a patient does have sleep apnea, whether there's any evidence of significant sleep apnea. It can be fragmented sleep, so even if you're sort of waking up a few times, maybe more than you would normally when you're not carrying out the study, then again that's okay, because we can just remove that data and really just look at the data where you're asleep. You can do sort of things to hopefully improve how well you'll sleep on the night of your test. So for example, the night before, if you just the morning before, sorry, if you just get up maybe an hour earlier than you would usually, and then by the time you go into bed that following night, then you'll be a little bit more sleepy and more likely to then fall asleep with the piece of equipment on. or it's sort of just a watch. So you can practice with a week leading up to it, wearing a watch whilst you're asleep, just to get your body used to the feel of it, just so you've got that reassurance that you then will feel comfortable sleeping with the test on.
Brilliant. Great. Well, if you do have any questions later, you can always email us. So we're info@thebettersleepclinic.co.uk. That was probably in one of the emails that came out earlier. So if you do have any questions that you think of later, do let us know, and we'd be pleased to get back to you. But otherwise, thanks very much for joining, and hope to hear from you.
Thanks, everyone.